People often confuse hospice and palliative care. In fact, hospice care includes palliative care within it. However, the two can be separated as different services. To understand how and why, let's define both. We'll begin with palliative. Palliative care can be provided for patients with chronic, serious illnesses like cancer, heart disease, or respiratory disease in their preferred location. The goal? To help people live longer, happier lives. For non-terminal patients, palliative care is about managing the symptoms and side effects of life-limiting and chronic illness. You can receive palliative care at the same time you receive treatment to cure your illness. Palliative care looks to make these conditions as manageable as possible so they don't interfere with the patient's lives. It's important to note that someone can receive palliative care at any stage of an illness, whereas hospice care is only appropriate at an end-of-life stage. Which brings us to hospice. Hospice care focuses on patients expected to live for 6 months or less. When curative treatment is no longer an option, hospice professionals work to make the patient's life as comfortable as possible on a physical, mental, emotional, and spiritual level. This means that hospice care includes palliative care because the goal is to manage symptoms and provide as much comfort as possible. At Crossroads, our specialists perform pain and symptom management at the patient's home, nursing home, or hospital. If you have additional questions on the differences between hospice and palliative care, please feel free to call at any time.